Okay, good afternoon, everyone. My session is short. I survived. Okay, thank you. I survived cycling a short 130 km just now under the heavy rain at Putrajaya. Can quickly rush back to my gallery, take a bath, and reach here on time, or before time, or something like that. Okay, good afternoon, everyone. My name is Vincent. I'm actually one of the director of KL Wellness City. I'm in charge of the sales, marketing, branding. And today, I'm going to do a little bit of sharing about a topic that was given to me, a little bit about healthcare entrepreneurship. I guess the best person to talk about this should be my managing director, Dr. Colin Lee, who actually built Tropicana Medical Center about 10 years ago. And thereafter, when we got it public listed, the first IVF hospital in the world to got public listed in any stock exchange, we actually disposed and sold our controlling stake to Thomson Hospital, Mr. Peter Lim, the Singaporean. With that, we have a little bit of funds, and you know Sing dollar is very strong. We have a little bit of fun, and we eventually, KL Wellness City eventually invested on a 26.5 acres of land to build several hospitals at Bukit Jalil, opposite across the road of Pavilion Bukit Jalil. So instead of Dr. Colin Lee, I thought that I will, on his behalf, do a little bit of sharing, a little bit of angling. This content is a little bit unique. It's meant not to talk about us, but it's meant to share that somehow our current shareholders and owners of KL Wellness City, comprising almost all of them are medical doctors. We don't really have businessmen or property developers as a shareholder in this company. So I work for a group of doctors, medical doctors, who eventually, after building, running, managing several different chain of clinics, building and running hospitals and all that, eventually here we are, talking a little bit later on the second part of my session about KL Wellness City. Now, healthcare entrepreneurship, this topic, a bit unique. A lot of, to be very honest, in the last 2-3 years, a couple of magazines internationally approached us wanting to interview our shareholders. Anyway, all of them are medical doctors. But it has always been a practice that we don't want to do any interviews. I mean, medical doctors, why you want to tell the whole world what you're doing, etc. Probably a lot of them were thinking and wondering why a medical doctor want to go and ended up running, managing businesses, and at the same time, still maintaining your clinical practice and all that. How did our current shareholders do that? So our current shareholders, apart from being the owners, the actual shareholders and directors in KL Wellness City, they are still running and operating and own several other medical centers and outfits in Malaysia and overseas. All right. So a lot of healthcare-related magazines and some economic magazines, all that, in the Asia Pac and all that, has always wrote in and then called us and said, hey, can we do a coverage and all that? But so all this while, we try not to entertain and have that. But today is going to be a bit unique. I'm going to touch a little bit, not just us, but about other people as well. So healthcare entrepreneurship, is it clear? Okay. Involves creating and managing innovative solutions that improve healthcare delivery, efficiency, and outcomes. Combines the fields of healthcare and business, focusing on developing new products, services, and technology. Wow, this is like a whole kind of definition. But what are we talking about? I'd rather go straight to, rather than a dry definition, let me share what some people have always wanted, and some doctors, all right, and pharma companies have always, in the past 3-4 years, approaching us locally and internationally, talking about collaborations, want to be co-developing, co-owning healthcare institutes and all that. So I'm going to run through a few healthcare companies. I'll probably take one of our sister company, Alpha IVF Group Berhad. So this company started sometime 2011. That's after when we sold off Tropicana Medical Center. And in the country, probably quite a number of existing IVF companies, doctors, they do come from the same group, from Alpha or our previous partnership. So since 2011, Alpha started off, this fertility center. It was run by from 6 leading doctors and embryologists, ONG doctors. And 3 months ago, sometime in April this year, we accidentally got listed in ACE Market. Some people say, why did you go to ACE Market and not main board? So what's significant here is this. With 3 small little clinics, 2 in Malaysia, 1 in KL, 1 in Penang, 2 in Malaysia, plus 1 center in Singapore, which opened only last 3 years ago. And as we embark on the corporate exercise, and now with a total of 11 IVF doctors, or ONG doctors, of which some of them only joined us 1 year, 2 years, and 3 years ago, respectively. So when we started with 6. Then eventually we start inviting more doctors to join us. And most of them came from public and private hospitals. When we got listed and went public in March 2024, that's only a couple of months ago. And today you can still Google up and see what was the closing price as of Friday. We accidentally got listed with a market cap of 1.55 billion ringgit. What is 1.55 billion ringgit? Share price multiply the total share. That's the worth of the company. If you want to take the company private, to buy 100% of the company. What does 1.55 billion means? Accidentally, some of the new doctors that joined us in the past few months, in the last 1-2 years, holding and offered some shares, free shares or whatever, not 5, 7, 10%. Accidentally, if I take a 10% just for simple calculation, 10% of 1.55 billion means you accidentally got a pile of shares, not physical share cert, but you actually your net worth of the 10% of 1.55 billion ringgit means the ONG doctor who was previously the last 1-2 years in any private hospitals that, of course, some of them joined us, they actually got 155 million ringgit of net worth. Honestly, when I was chatting with my managing director, Dr. Colin, who also is a founder and started with Alpha, I said, Dato', when you offer some of the doctors ONG to join you, not all of them believe you, right? They didn't quite want to join you. He said, yeah. Every 3 doctors I spoke to, only 1 agreed to join me. But I was so busy, I just probably picked the best, or the good ones, or the one that really believe in our vision and the direction. And I said, I really wondered those that rejected you and didn't want to come on board, what was in their mind? You told them you're going for corporate exercise. And you are offering them share. And then you accidentally got listed in the next 1-2 years. Wow. You should send the news to them. Had they been holding the 10% share, how much was their net worth? Bear in mind, whatever they were in X, Y, Z private hospitals, that they are seeing patients, the income that they get, I generally say would not be lesser than whatever they are with Alpha IVF. So what I'm trying to take from this example here is this: entrepreneurship. None of the doctors in the Alpha gets involved in managing and running the clinic or medical center. It's still run by a group of professionals, from the finance, from the corporate governance, company secretarial, accounts, finance, and all that. It's still run properly. There's still a full marketing team talking about expansion, talking about international patients and all that. The doctors are still doing the same thing. None of them were supposed to be there, talking about, holding press conferences and do all these exercises. So now recently, with being a public company, and we actually got an offer and got a piece of license in Indonesia. And then they're going to do the announcement soon. And upcoming the other countries as well. And recently, after the went public 2 months ago, on 27th of July, we launched our fertility center inside KPJ2. And don't be surprised, Alpha will probably may accidentally end up in most of the KPJ thereafter. Okay? Now, this is what we call a public company. So entrepreneurship is not just about clinical. Yes, you actually should just focus on clinical, but if you're with the right team, whichever, not just Alpha, any team, think out of the box, get to know what the whole process is. Definitely, lots of things can happen from there. Another one, this is another good example. DC Healthcare Holdings Berhad, of course, is known as aesthetic clinics. Clinics in KL, Shah Alam, JB. They had about 39 dedicated doctors at that point of time. Skin aesthetics expanded to 13 branch. Well, way to go. I think they will just grow stronger and stronger. And got listed in 2023 in ACE market. Market debut with 60% premium. That's very good. That's very good. That's good for the existing shareholders. That's very good. Then we move on. Look about some other examples. Metro Healthcare, or known as Metro IVF. Dr. Tay is the founder of Metro IVF. 2024, listed in the ACE market in the Bursa. All right. Engaged in providing inpatient services, outpatients, fertility, ops, gynae. All right. And a whole range of it. Maybe some of you may have some encounter or some partnerships with them along the way. But these are the companies that have got listed. Do the doctors actually go and run the company every day and then talk about signing checks and all that? Not really, unless there's only one or two key owners or doctors who are actually hands-on. Talk about a bigger boy, the big boy in the market. IHH Healthcare Berhad, established since 1974. A lot of corporate structure, corporate exercises, all right, and then eventually, supposedly, and hope they're still, I'm not too sure, but I still hope that they are still Asia's largest private healthcare group. But moving forward, yes, I think they have established themselves. They should be. Footprint in Malaysia, Singapore, Turkey, India, Greater China, including Hong Kong, Central and Eastern Europe. Okay? I think the last count when I asked, they told me about 90 plus, but at that juncture, probably 80 hospitals in 10 countries. In 2012, got listed in main market, and secondarily listing on the main board of Singapore Stock Exchange. Yup, a little bit of change hand, who's the owners and the major shareholders and all that, but nevertheless, born and bred from Malaysia. Of course, currently probably Singapore entity does take a very substantial controlling stake there in the IHH. What about the next one? This one everyone knows. So you see the example that I showed earlier, all those are owned by doctors and is spearheaded by doctors anyway. All right, so we are talking about entrepreneurship. We're talking about moving forward. CVS KL, November 2017. 60-bedded, houses a full range of cardiology, cardiothoracic, and etc. Okay, yes, it's a subsidiary of TE Asia Healthcare, and yes, TE Asia has started acquiring more and more hospital and medical groups. Okay,